A couple of months ago, we had 4 Ontario mayors on this program sharing their solutions to the homelessness and addiction crisis in their communities. We got some feedback on that episode from other mayors who said, however well-intentioned those solutions were, ultimately, they probably wouldn't get the job done because they weren't radical enough. Let's hear those arguments tonight. And so we welcome, in Kingston, Ontario, Mayor Brian Patterson. In Oshawa, Ontario, Mayor Dan Carter. And here in our studio, Chan Liggett, she is the mayor of Cambridge. Kevin Davis is the mayor of Brantford. And Alex Nuttall is the mayor of Barrie. And we are delighted to welcome you 3 here to our table in Midtown Toronto, and to our mayors and points beyond. Thank you for joining us on TVO tonight as well. I just want to bring up a couple of the bullet points here from the resolution that the Ontario Big City Mayors Caucus passed on this past Friday regarding the homelessness encampments, addiction issues in this province. Here is some of what was agreed to by the Big City Mayors Caucus. Sheldon, bring this graphic up if you would, please. Establish a priority in maintaining public safety to allow stronger deterrence to social disruption and public safety risks. Seek intervener status in court cases that restrict cities from regulating and prohibiting encampments. Introduce legislation to prohibit public intoxication and public use of drugs. A quick build of supportive housing units, and review and update the Mental Health Act and the Health Care Consent Act to expand the scope of mandatory addiction care and treatment. Okay, Mayor Davis, what is different about this approach from perhaps the approach taken by the other 4 mayors who were on this program a little while ago?
Steve, it's actually complementary. It comes out of the meeting we had in August where we passed the Solve the Crisis resolution, which was the subject of your prior show. At that meeting, some of us decided that we needed to be a little more specific in terms of what we were asking the provincial and federal governments to do. I was asked to prepare a draft resolution, which is what I did, and that was considered by the same group this past Friday. So it was really, I call it supplementary, kind of a follow-up to the Solve the Crisis resolution.
It sure, Mayor Carter, I'm going to bring you in for the supplementary here, because you may be the only politician I know who's actually lived in the streets, having suffered from addiction issues many years ago. What do you think about this approach will get you closer to where we need to go?
Well, first of all, it's great to be able to be with you and our colleagues that are there. And a special thanks to, of course, your in-studio guests that played a significant role in regards to bringing this forward. I think the reality being is that all of us are witness in our community that what we're doing at this particular time is not what our intent is. And our intent is to make sure that every child that is out on the streets, and there's somebody child, that we are doing everything we possibly can to save their lives and make sure that they are on the right pathways in regards to better health and better outcomes. And I think that's what the intent is. As a recovering alcoholic and drug addict myself, intervention has played a significant role in regards to my own recovery. And I think that that's where I think we need to really say to everyone, let's find a way of being able to introduce compassionate intervention, and let's find a way of being able to help these individuals that are suffering. By the way, the toxicity of the drugs that are out on the streets right now is nothing that we've ever seen in this country before. So I think it's time for bold action and big steps. And I think that this motion, along with our colleagues, is taking this opportunity to be able to move forward with it. So again, as intervention plays a significant role in regards to what we're trying to accomplish.
Let me, Mayor Liggett, figure out what bolder action means. For example, you say you need stronger deterrence to ensure public safety. What does that actually look like?
Well, a stronger deterrence without the police enforcing some of the laws that we already have in place, and I think there's some reticence on their behalf. We also need courts to enforce, once the police bring that forward, we need the courts to be able to have some sort of verdict come down as to what happens to the people, and you know, with the lack of resources for that, it really gets very difficult. There are some municipalities where the police actually will walk up and take drugs away from people when they see that happening. But we also have a provincial chief of police association who sort of makes up the rules for all of the police departments. So until they start all doing that, we're not going to get anywhere.
Which is what you want? You want them all to do that?
Yes, I would like to see them all do that, because then it, you know, that gives the incentive to the addict to, if they can't find another drug source, quickly, then they have to look at what they're going to do to help themselves out of the situation. So people talk about how you can't force somebody to go to rehab. Well, yeah, we can force somebody to go to rehab if the deterrents are there.
Okay, let me pick up on that with Mayor Patterson, because again, one of the provisions of the agreement that was passed last Friday is expand the scope of mandatory addiction care and treatment. So Mayor Patterson, what does that actually look like?
Well, I mean, I think the starting point is to recognize that we already have a system of mandatory treatment that's in place. I think that the issue, and really this was really at the heart of the discussion that we had as a group on Friday, is do we need to have a look at that system? Does that system need to be updated? Does it need to be modernized? I think recognizing, as Mayor Carter has said, that the conditions and the challenges that we're seeing with the drug toxicity crisis, the sort of behaviors that we're seeing, the sort of challenges to our communities, to say, okay, do we need to change the approaches and how this is working on the ground? And I would suggest that I think we can all agree that the system that's in place is not working. The status quo is not okay. And so this is one of many different tools that I think we could look at to, again, take an empathetic and compassionate approach to those that are suffering with addictions and mental health, and also find those solutions that work best for the community as a whole. So, on the one hand, we're pushing for more resources and more treatment and more supportive housing, but we're also saying that maybe looking at the Mental Health Act that hasn't been updated in 30 years, that's something we should be doing as well.
Mayor Nuttall, let me try to characterize what I think some people have, objective observers have said, this is the approach you're looking at, and you tell me if I'm right or off base. This approach appears to be less concerned about niceties around civil rights and more concerned about actually getting a job done, more concerned about getting people who are a harm to themselves and others off that situation. Is that fair to say, to characterize it that way?
Yeah, Steve, I think that's taking one side of the equation into consideration. I think we have to remember that these parks where folks are overdosing, where they're leaving needles, where in some cases becoming violent, having psychotic episodes, those are places where others have civil rights to be as well, where children have the opportunity to go and play with their families and friends, where they have the right to be safe, where they have the right to be part of their community. And so I think the balance here is, A, helping the individual who's going through these types of episodes and this type of addiction and these behaviors, and at the same time looking at those in our community who are trying to use these parks, which oftentimes are beside schools, for what they were designed to be used for, which is a safe place for kids and for families to play. So I think the resolution as a whole is trying to walk that balance between how do we help those who are hurting, and at the same time, how do we ensure that we have safety and security inside of our communities?
And follow up with you. Would you like to see the use of the notwithstanding clause used by either federal or provincial parliaments in order to give you folks more power to do what you think needs doing here?
Steve, I think it's something that's already happening across the country, and I think it's something that has to be considered. And I'll give you an example, that something that people know a lot about, and that's bail reform. And a lot of people criticize the federal Liberal government, the Trudeau government, for the bail reform package they brought in 2 to 3 years ago. All they really did was they simply codified decisions and principles that were decided by the Supreme Court of Canada. And so if you're going to deal, if you're a government, you're going to deal with bail reform in a meaningful way, you're probably going to have to use Section 33. But if I put it in the context of what we're talking about with the homelessness and whatnot, I liken it this way. So as an elected official, when I make decisions, a lot of what I'm trying to consider is the future. What's the impact of whatever we're doing on our community, on the people in our community? Is it generally good for our community? So I try to be future forward looking. And the difficulty with courts is courts don't think that way. They tend to be looking in the past and looking at what was done in the past and did that comply with the charter. Where the difficulty is, once a court determines that, like a court determines that there was, say, an infraction of bylaw, was in violation of a charter right, they then determine whether there's reasonable justification. If they determine there wasn't, they then look at what could be done. So now they're getting into making a decision on public policy. That's forward-looking. And the whole court mechanism in terms of the kind of evidence they have, the input they have, it just is not the same as what an elected official does. We have so much input when we make a decision like this, plus we're making a decision that's a group decision. A judge is acting by themselves, and I have found in my experience that the best decisions are made in a group. So I think what's happening...
Judges can act as a group as well.
But the difficulty is the courts are not, I don't think, set up, because once they get into deciding public policy, then it gets really messy. For example, there are a number of court decisions in BC and in Alberta and also in Ontario on encampments. It's really difficult to pull from those court decisions a coherent set of principles that apply in every community. That's the challenge. And so then it becomes a situation where you really don't know what the law is.
Let me try going to Mayor Carter on this, because when people start hearing that governments potentially want to use the notwithstanding clause of the Constitution to set aside constitutionally protected rights because the legislatures, the elected legislatures, think they've got a better idea, obviously some people get skittish. So what's your view on the advisability of using that part of our Constitution to set aside civil rights because you think what's going on right now is so urgent it's required?
So understand, this is my opinion. And my opinion is we are in a crisis across this nation, matter of fact, across North America. I think it's about time that we take bold steps to be able to address the worst healthcare crisis this country has ever seen. We've got to take whatever steps are necessary to be able to save the lives of those that are suffering in addiction and mental health. We're not doing enough. We need different tools. We're bringing ideas and solutions forward. I urge the provincial and federal government to get uncomfortable, to take on this challenge and say, the reason why we're doing this is because of the reason that we want to save your child's life. Do you know 46,000 people have died with drug poisoning since 2016 across this country. We continue to see people die on our streets. We can't sit by and continue to do what we've been doing and say, well, we'll get there someday. Someday is today. It has to change today. It's worth the fight, and I think it's worth the challenge itself. I think it'll bring it as a national conversation that absolutely needs to be to happen. So do I encourage the provincial and federal government to take the appropriate steps? Absolutely, and I want to see it done immediately.
Mayor Leggett.
Thank you. We must remember that when the Charter of Rights was brought in, we didn't have this crisis. It didn't exist.
Right. That was 40 years ago.
Exactly. And so now we're looking at mental health problems where people have psychotic episodes and hurt people badly on the street. We have an entire generation of people who are addicted and may never come out of that addiction. We may have to look after them for the rest of their lives, but that number keeps growing over and over and over again. And I'm sure if the writers of the Charter of Rights could have foreseen this, they would have put some caveat in there in order to protect us today. But it's not there. So that means we have to pick up the next stage of that. And so there's some of us here today, maybe all of us here today, who would like to see the notwithstanding clause used. And I'm one of them. It didn't pass through the big city mayors. We had a conversation about it. Not everybody was on board, and we didn't want to push that. But that doesn't mean we haven't opened the door for it. It doesn't mean that we're not going to continue to press for that in maybe another way. But I strongly believe, and I'm being a leader of my community and representing the people of my community, I want to see it used. And I'll bet you the majority of mayors in this province would as well.
Let me get Mayor Nuttall on this. Do you think we need to get, as Mayor Carter says, uncomfortable with the notion of taking away the civil rights of people who are struggling with homelessness and addiction for what they would consider to be a greater good?
Well, Steve, if you think back to 30 years ago before the closure of mental health institutions in this province, it wasn't unconstitutional. There were beds, there were opportunities. Was it done perfectly? No. Were there problems with it? Yes. But the reality is that today we're now living those problems out in parks and in public spaces that were previously lived out inside of institutions. So the request to the provincial and federal government, let me be very clear. I have requested publicly Premier Ford and Prime Minister Trudeau to use a notwithstanding clause to create legislation to allow municipalities to gain back control of public spaces. I think that you'll find that there's certainly on this panel some widespread support for that. Kevin has done a ton in terms of putting that into a motion, and we didn't adopt all pieces. That piece wasn't inside of it. But outside of big city mayors, the answer is yes. We cannot get control back without the use of the notwithstanding clause. That's the reality. We know that. We need the provincial and federal governments to step up with competent legislation that restores safety, security, and helps those individuals who are suffering from addictions and mental health issues.
In which case, I'll ask Mayor Patterson, do you think the big city mayors caucus chickened out by not going forward with this notwithstanding clause aspect?
No, I wouldn't characterize it that way at all. I mean, I think we had a very robust conversation about, how do we address the real challenges that we're seeing? And perhaps I'm more of a moderate in the group. I too tended to kind of stop short about saying, do we need the notwithstanding clause if we already have a system of mandatory treatment that's already in place? So this is not new. As a community, as a country, as a province, for years, we have a system right now that if someone is a danger to themselves and a danger to others, that they can be detained and get the help that they need. So it's not clear to me that we necessarily need to bring in that hammer. I think what we do need to do is review and say, maybe we need to take the existing system that's already there and expand it. So as my colleagues around the table who, quite frankly, I agree with the goal here that we want to get people the help that they need. So let's find that way. So I think that there's a really important nuance here that I think that came out in that discussion of the group, is to say, let's review the Mental Health Act. Let's review the system that's already in place and say, how do we expand it or strengthen it to make sure that we're addressing the problems that we're seeing on the street? And I absolutely agree with my colleagues around the table on this, that something has to be done. The status quo isn't working, and so let's work together on finding that way forward.
Mayor Carter, do you think this group put too much water in its wine, taking, if I can mix my metaphors here, too much of the teeth out of the idea that you guys are putting forward here?
You know what? I mean, I have a very strong opinion in regards to taking on this fight, and I think it's worth a fight. But I also respect my colleagues in the caucus itself in regards to the decisions it made. I think it's giving everyone a fair opportunity to be able to answer the call. We're challenging the Premier and the ministers and, of course, the federal government to do the right thing because of our belief that this is an inhumane way of being able to deal with things. So in my own personal opinion, I wish that we were a lot more forceful in regards to it. And I wish that there was more talk about compassion and intervention. But I think the spirit of this organization and the caucus itself has the intent of not only challenging those that are charged with the duty of governing our municipalities and our province and our country, but also the opportunity to be able to say to all of us, what we're doing right now isn't working. So let's take some bold steps. Let's take on the fights and let's move forward. So personally, I really feel that we're at that moment. We can't be cutting around the edges. We've got to get right to the center of this and take it head on.
Mayor Davis, you don't have the power to do this. You need Premier Ford to say, yes, I'm prepared to use the notwithstanding clause to set aside these civil rights because the situation is so urgent, and therefore we'll give you the power to do what you feel you need to do. That's the argument you're making to Doug Ford. Have you heard back from him on whether he's prepared to entertain that idea?
Well, Steve, that's not the argument we're making. If you look at what the OBCM has done, and the essence of what we're done, we're asking the province to, in particular, look at for example, a drug diversion court, and implementing that province-wide and providing the necessary supports for that. And
you're
also,
not making that argument. You're not making the argument.
No, we're making that argument. And when it comes to the mental health,
no, you're not making the argument about the notwithstanding clause because you put water in your wine and decided to pull that.
But you're
to get a resolution.
But you seem to be suggesting that you have to use a Section 33 notwithstanding clause. You want to improve the mental health act. That's not necessarily the case.
I'm not saying you have to do anything. I'm just saying, obviously, Mayor Liggett's one, Mayor Nuttall's another one, Mayor Carter's another one who says that you may have to do this. Have you asked the Premier if he'd do it? And if so, what did he say?
Well, the OBCM has asked the province to do an in-depth review of the Mental Health Act and also the Drug Diversion Court System, also the Trespass to Property Act, and that's what we're looking forward to the province doing, taking an in-depth look at that. And depending on what they decide they do to respond to this, it may, by necessity, require use of the Section 33 notwithstanding clause. But that's not the thrust of what we're asking the province to do.
Do you think you should be asking the province to use the notwithstanding clause?
It depends on what it is you're trying to do and whether or not you think you need to use a Section 33 notwithstanding clause to achieve it. right? I gave you the example of bail reform. If you're going to do bail reform, you have to consider it. It depends on what you do with the Mental Health Act. For example, community treatment orders. They're a great method for encouraging people to continue with receiving the treatment they receive. And that's where they're released from a facility and they have to follow a treatment program and community nurses check on them. The problem I'm hearing from those who are involved in that system is it's not long enough. They're only in place for 6 months. So, for example, one of the things the province can do is extend the period for community treatment orders. Would that require Section 33 of the notwithstanding use of that clause? I'm not sure. But so your equation, which is if you do anything, you have to use Section 33, is not correct. But I agree with Mayor Carter. This is a crisis. It's an urgent crisis. We need to take decisive action, and that may require Section 33. If it does require Section 33, then we're asking the province and the federal government to consider that, given the ultimate goal of what you're trying to do. You're trying to make sure people recover, and they have a pathway to a healthy lifestyle. What's wrong with that?
Mayor Liggett.
Well, I would say that if we're asking the Premier to take this huge, massive step, then we have to have the steel in our backbone to say, yes, this is necessary. We've got your back. Please have our backs.
And do you? Do you, as a group of mayors, have that steel in your back?
Well, I would say a large part of us did. We work by consensus in that caucus, though. So we tried to come out with the best motion that we could put together based on all the different viewpoints around the room. When we went into it, I would say, yes, we probably did have the majority for that. But working by consensus, that's how we got the water in the wine, as you would put it. I agree with you 100%. But, like, what you tell me what leader of a province is going to go into something as drastic as this without knowing that he has the other leaders of this province supporting him when he does that, especially with an election potentially coming up next summer. Well, we better have his back if this is what we're going to ask him to do.
Premier Ford has shown in the past that he's prepared to use the notwithstanding clause on other things, and he doesn't care if people support him or not.
I think he does in this one.
In this case, he does.
I think he does, and we've opened the door with this motion for him to be able to use it. But you're right in asking that question. Maybe he needs to hear it publicly. Maybe more mayors need to come on board and say that they have problems in their community.
And I'd say as well, Steve, City Hall in Brantford is in the middle of the city. It's downtown. Every day I drive into work, I see what's happening on the streets. And you know what I find most heartbreaking are those that probably have some kind of serious mental health issue. And you see them there day after day, and you can tell that they're living a tormented existence I couldn't even imagine their internal demons. And we're saying in defense of Section 33, they should remain there without the necessary compassionate care and treatment that they need to recover? How's that compassionate? How's that humane?
Mayor Carter wants in.
Yeah, I was going to say, all across this nation, this conversation is happening. British Columbia has taken talk about what they need to do differently. Alberta is taking bold steps. I know New Brunswick is having bold steps in regards to what they're looking at. This is a national conversation, and I think that what's happening is it is finally in a place where I think those that are provincial leaders and federal leaders can see that there is an absolute appetite in regards to a different pathway forward, because we want to see the deaths stop. We want to see a solution brought forward. And we also understand that this may mean that all of us are going to get really uncomfortable with some spirited conversations, but it's worth the conversation because it will save lives.
Mayor Nuttall.
Yeah, I think that there's some things that are being brought together that don't necessarily exactly fit, but they influence each other. When you're talking about addictions and mental health treatment and some mandatory care related to that, we're also talking about encampments and the situations around encampments, the violent situations we see inside of encampments. Oftentimes we have guns that are found, certainly knives that are found. The Section 33 piece is not up to a group of mayors to determine. It is up to the provincial government to determine how they bring legislation forth to meet the requests and demands of the mayors. And that is what we're asking the provincial government to do. Determine where and when to use it. On the encampments, it certainly, from everything that I've seen and everything that we've discussed, it appears that a Section 33 will be needed. When it comes to the mandatory treatment, if the beds are there, the hospitals are there, the funding's there to support and help these individuals, there may be a way to move through it without a Section 33.
Well, that's the question, though, isn't it? Are those wraparound services there? Is that, are those support services there? Are those homes there?
They're not, but they will be, I believe, if we see the increase in funding and if the government takes it as seriously in the next 2 or 3 years as they have in the last 2 or 3 months. The Heart Hub funding is a significant step forward in the province of Ontario. It's only 10 centres right away, 19 overall. I would guess that we need centres in every geographic region, and we're not going to do it with just that announcement. There's got to be a lot more.
Mayor Patterson, I haven't heard Mayor Patterson a bit, so let me get him in here. There was I don't know what else to call it. There was a shocking and violent attack in one of your encampments in Kingston not that long ago. There were fatalities involved. People in Kingston are asking the question, people all over Ontario are asking the question, what do you need to do to make sure that that kind of thing is brought to an end?
Well, I think that this really goes to the heart of our call that, quite frankly, we've been talking about this for over a year, about the importance of having the tools, having the legislative tools or the resources to be able to effectively deal with the very serious side effects that we've been seeing with encampments. I think that the biggest challenge for me was that that tragic event that happened back in September, it didn't need to happen. We had seen all sorts of warning signs. There were all sorts of dangers. And again, I'm not talking just even to the surrounding neighborhood. I'm talking about the health and security of those in the encampment themselves, those that are just trying to make ends meet, to try to get through the challenges that they're facing. And not being handcuffed and not being able to help address their safety, as well as the safety of the surrounding community, it's been incredibly challenging and frustrating, I think, for myself and for everyone at the city. And so that is, as you've heard, this is where we're asking the provincial and federal governments to step into the fray here. Give us the tools, give us the guidance, because we're all struggling with it. And I think, it's been said by a couple of my colleagues, the courts are making these one-off decisions based on specific circumstances on the ground, and then suddenly, we don't know. Communities don't understand. Okay, what can we do? What can we not do? How do we best address the safety of everyone involved? So, I think that this is a big challenge. Yes, and at the same time, do we need more resources and more treatment? Absolutely. I tell the story in Kingston about how there's one publicly funded treatment center in Kingston. It has a 6-month waiting list, and it's only open to men. We need more resources for treatment and for recovery, and so places where supportive housing for people to be able to go in encampments, and we're trying to do all those pieces. But we also need the tools from the province to be able to deal with the real dangers that we're seeing in encampments.
Yeah, and that was a major improvement at what happened at the Friday meeting of the OBCM, and that was really bolstering the sections of the revolution.
Big City Mayor's Caucus.
Ontario Big City
We
Mayor's.
hate acronyms here.
Okay, the Ontario Big City Mayor's Caucus. But anyway, the sections that make the request to the province to expand and bolster the treatment system, that was actually strengthened. And that's an excellent point, because the treatment hubs are a good initial step. Much more is needed, both for involuntary treatment and also for voluntary treatment. Plus, there's a section there that I really like, and that's diversion courts. When you talk to people who've recovered from a lifetime of addiction, like Marshall Smith, who is Chief of Staff for the Premier of Alberta, he will tell you that it was getting involved in the criminal court system and being given the option of treatment and rehab. That is often a great pathway without involuntary treatment to recovery. And the problem with our diversion court system here in Ontario is it's not widespread enough, and you don't have the resources to back it up, so that if there is a rehab referral and someone chooses to take it to avoid going to jail, it isn't there in many cases. And so that's a big part of this resolution, insisting the provincial government do more to bolster and expand the system that's there for treatment.
So, okay, go ahead, Mayor Liggett.
So, as you may know, I did a poll. I commissioned a poll that went province-wide that came out in August, right, and it was delivered at the Association of Municipalities of Ontario, to not do an acronym. And in that, 4 out of 5 people said they wanted to see a dedicated fund created to solve these issues. But when I look at what the province was delivering, and I think it's $384 million, if I'm correct, to go to solve this problem.
For heart hubs.
That's absolutely nothing, because there's no bricks and mortars, there's no staff to provide for this, whether it's mental health or whether it's addiction. There's none for detox, for rehab, and then recovery beds are a big thing. You know, that's the biggest part of rehab, is the recovery beds. So I just estimate if we had that $1 billion a year that was lost as revenue from the license plate stickers, if we could have $1 billion a year dedicated to this, within 5 years, I think we'd be at a point where we could see some daylight at the end of the tunnel.
It may get worse. I understand next week we're going to hear that we're about to get $3.2 billion worth of $200 checks in our pockets.
Yeah, well, would
you rather have that money to spend?
I would rather, and part of the poll was I wanted to know if people were willing to spend more money in taxes to offset the cost of this. Surprisingly, a lot of people didn't even know what the services were in their own communities. So
I got about a minute and a half to go. Alex Nuttall, for you.
Well, I think one of the questions you asked earlier was with regards to the Premier and other levels of government. And I think the Premier actually has answered questions on this. He has said, in response to the motion that Kevin drafted with everybody who's here, that he did want the mayors to ask him to do something, that he did support the mayors coming together and taking on this motion and providing some advice to the provincial government. And so I think that that's a good step forward, because it's a recognition this problem is so bad that we need the multiple levels of government working together. We hope to get there with the federal government as well, because it's going to require funding from the feds, it's going to require the services from the province, and it's going to require the bylaws from the municipalities.
Thank you, everybody. I want to thank our 5 Your Worships for coming into TVO tonight, both actually and virtually, to help us out with this very complicated discussion. Brian Patterson, the Mayor of Kingston, Dan Carter, the Mayor of Oshawa, and here in our studio, Jan Liggett, the Mayor of Cambridge, Alex Nuttall, the Mayor of Barrie, Kevin Davis, the Mayor of Brantford, who's also a Ticat fan, I think.
I am.
I knew there was something
And a
about
Brantford
you I
Bulldog
liked.
fan, too.
And the Bulldogs, too, which also used to be in Hamilton. Thanks, everybody. Appreciate your time tonight here on TVO.